Does menopause always go away?
Well, all women stop having periods at some point.
Yeah. So that's menopause.
That's menopause.
Then the symptoms.
The symptoms, for the vast majority of women, yes, they will. And my job is to help transition women who are bothered by their symptoms. And I think that's a big thing a lot of patients don't understand. If you're having some hot flashes or night sweats, but they're not interfering with your life, then it's okay to just to live with them. And as a matter of fact, a lot of my patients do nowadays. But if they're really interrupting your life, if they're increasing your stress or your anxiety because you're not getting good sleep, or it's interrupting your marriage because you can't enjoy sexual relations with your husband. I mean, those are opportunities that we have to help offer women different treatments.
It must really be a real smiling, happy sort of sensation to be able to see people that are having problems and know that there's something that you can do for them on almost anything that goes on. So women that have gone through menopause see their doctor. How often should they go for a routine check?
Well, that's a little bit controversial, but if you ask an OB/GYN, we still honestly believe that women need to have a GYN health maintenance exam once a year.
And they have it once a year. What are you looking for? They've gone through menopause. They're not going to have children anymore. What are you looking for?
Well, so we're looking obviously to assess risk for breast cancer. I still do an exam. I still talk to women about their breasts. I'll always continually evaluating for family history. There's obviously women will experience other symptoms, sometimes not just vaginal dryness, but maybe some vaginal itching. The vulvar area and the outside of the vagina are at risk for developing cancers, and nobody else is looking down there, unfortunately. Also, too, we want to make sure that women understand. You'd be surprised how many women will have a little bit of bleeding or a little bit of blood, and they don't really know where it came from, or they think maybe that it came vaginally, but that is a sign that it could be a cancer, and we definitely want to make sure that we're evaluating for that. The other thing I like for patients to be evaluated for is just to make sure that they're not having any abdominal bloating. Ovarian cancer symptoms are extremely subtle, and sometimes women don't have them until it's well advanced. So just having a pelvic exam, or at least talking to someone about symptoms of weight change, abdominal bloating, increase in abdominal girth in their abdomen, all of those things are very important. And sometimes you don't think about them because they happen slowly or subtly unless somebody asks you.
That's right. And asking is the important thing, because, oh yeah, I've got bloating, or oh yeah, I've got some discomfort, oh yeah, I haven't had my mammogram in 2 years, or things like that, that you can help them and guide them through this time of life.